Good afternoon. Although it may seem like months ago, it was only on March 23rd, which was 35 days ago, that we issued an emergency order requiring the closure of all non-essential businesses due to COVID-19. For a little context, this was also the same day that the Commonwealth reported 1,000 tests per day for the first time. Quest had just come online, and we were ramping up to an ambitious goal of 3,500 tests per day. We're now reporting anywhere between 8,000 and 10,000 tests per day, and sometimes more, which makes us the #2 test per capita performer in the country among the big states. And obviously, we think this represents progress, but sometimes it seems like a lot more than 35 days ago. At that time, we directed Public Health to also issue a stay-at-home advisory. These two decisions were absolutely necessary to slow the spread of COVID-19 and coronavirus. We know that those decisions have brought with them their own hardships. Kids out of classroom for the rest of the year, parents stretched to the breaking point, and in a time when we need it most, people are separated from those they love. People have lost their jobs, their careers, and in some cases, businesses they'd worked on for many years. Not acting, however, was not an option. Without any effective treatments or vaccines, and only a few weapons that we had to fight this virus, those decisions were made to save lives. Since we acted, we've avoided the humanitarian crisis that we've seen experienced in so many other countries and healthcare systems elsewhere around the world. The people of Massachusetts have definitely sacrificed, and they've definitely played their part. And together with our world-class hospitals, medical workers, first responders, and emergency management response personnel, we have flattened the curve. While Massachusetts has avoided the spike in infections that would have broken our healthcare system, COVID-19 continues to very much be with us in many communities. Our overall hospitalization rates for COVID-19 patients have not dropped. They remain high. Plateaued is the word I would use statewide, and many healthcare facilities are still relying on their emergency surge beds to treat patients. There are still approximately 3,900 people hospitalized for COVID-19, and we reported through our testing an additional 1,500 new cases yesterday. And while many people talk about the fact that the vast majority of the people who have not survived COVID-19 were people over the age of 60, I just want to point out that the folks at Mass General and the Brigham have pointed out to us that 44% of all COVID-19 admissions, 40% of COVID-19 days, and 44% of ICU days for COVID-19 are people between the ages of 0 and 59. Yes, they may survive, but many of them have a very rocky and rough road to get from here to there. So today we're extending the timeline for all non-essential businesses to keep the physical workplaces and facilities closed to all workers, customers, and the public until May 18th, and the stay-at-home advisory also remains in place during this time. We're bringing every possible resource to bear in this fight to get back to the so-called new normal, and a lot of what's happened in the past several weeks has headed us in that direction. We became the first state in the nation to launch a tracing program that will serve as a powerful tool to spot and stop new cases. The mobility data suggests that our state's efforts to close brick-and-mortar businesses and our calls for social distancing have played a significant role in stopping and slowing the spread of the virus. We've also expanded testing, and our daily average new tests this week, as I said before, have hovered around 8,000 to 10,000. This far exceeds that goal that we set of 3,500 cases a day, tests a day, a very short while ago.